Right, let's address the elephant in the room, shall we? The question I get asked more than any other, whether it's in my clinic in London, in emails, or even at dinner parties, when people have had a few too many glasses of wine and suddenly remember I'm a urologist. Dr. Caldwell, is there actually anything at all, that can make it bigger? Sometimes they phrase it differently. Can I add some length? Or, what about girth? Is there anything for that? And look, I completely understand why you're asking. This isn't some trivial concern. This is deeply personal. It affects your confidence, your relationships, your sense of who you are as a man. And after more than 30 years in this field, I can tell you with absolute certainty that you are not alone in thinking about this. Not by a long shot. Now, here's something that genuinely surprised me when I first saw the research. A massive international survey, we're talking over 50,000 men from across the globe, found that more than half, 55% to be precise, were unhappy with the appearance of their penis. More than half. That's an extraordinary number when you think about it. But here's where it gets really interesting, and I want you to pay close attention to this bit. When researchers asked the partners of these men, 85% of women said they were completely satisfied. 85%. So we've got this enormous gap, haven't we? Between how men perceive themselves and how their partners actually experience them. And that gap, that disconnect, it matters enormously because this isn't really about centimeters or inches on a measuring tape. It's about confidence. It's about intimacy. It's about feeling like you're enough. Before I get into the science, and I promise you I'm going to give you proper evidence-based information today, not the rubbish you see advertised online, I'd appreciate it if you could hit that like button. It helps other men find this information, and honestly, we need more straight-talking, honest health content out there. Drop a comment and tell me where you're watching from. I've had people comment from everywhere, Manchester to Melbourne, Glasgow to Ghana. And do subscribe to the channel because every week I share new research and practical advice for men's health, particularly for those of us who aren't 25 anymore and need information that's actually relevant to our lives. Now let's start by absolutely demolishing one of the biggest myths out there, and I'm talking about pornography. It's completely warped our collective sense of what's normal. What you see on screen, gentlemen, is not reality, full stop. It's performance. It's camera angles specifically chosen to exaggerate size. It's surgery, it's drugs, it's lighting tricks. It's about as representative of real life as a Hollywood action film is representative of actual combat. The performers in those films are selected specifically because they're statistical outliers. That's literally their job qualification. So what does the medical evidence actually tell us about normal? The average erect penis length, measured properly in clinical conditions, is about 13.2 centimeters. That's just over 5 inches for those of you who prefer imperial. And medically speaking, anything within a fairly broad range around that figure is considered completely normal. There's enormous natural variation, just as there is with height or foot size or any other body measurement. You wouldn't look at someone who's 5'8" and say they're abnormally short, would you? Same principle applies here. Now, let me address something specific, because I've had patients ask about this, and I noticed in the comments on similar videos that people want clarity on this point. A micropenis is a genuine medical condition, but it's defined very specifically. We're talking about a stretched or erect length of less than 7.5 centimeters. That's about 2.9 inches. And here's the thing, it's extraordinarily rare. It affects roughly 0.14% of men worldwide. So the vast majority of men who worry about their size don't actually have a medical condition at all. What they have is anxiety about their size. And that's a completely different kettle of fish, isn't it? This anxiety is so common that we actually have a clinical term for it. Small penis anxiety, or SPA, as we sometimes call it in the literature. And I want to explain why understanding this distinction matters so much. Because the more you obsess about size, the more it affects your mental health. It damages your relationships. It can actually impair your ability to perform. I've seen it hundreds of times. A man convinces himself he's inadequate, and that belief becomes a self-fulfilling prophecy. The anxiety causes erectile difficulties, which reinforces the negative belief, and round it goes. I'm Dr. Sophie Caldwell, by the way, board-certified urologist, spent more than 30 years specializing in men's health, working with the NHS and in private practice here in London. I've helped thousands of men with issues ranging from prostate health to erectile function to fertility. And a significant part of my job, frankly, is separating genuine science from the absolute nonsense that gets peddled online. Today, I'm going to break down what the medical research genuinely says about penile length, girth, and the various enlargement treatments you might have heard about. We're going to cover the real averages and why they actually matter, the mistakes men make when they chase risky or completely fraudulent fixes, and yes, the few methods that have been scientifically tested and shown to make a measurable difference. I'll also share what I actually tell men in my practice when they come to me worried about this exact issue. And I'm going to address something that I think gets overlooked far too often, which is advice for men who aren't currently in a relationship. Because telling someone your partner is satisfied isn't terribly helpful if you haven't got a partner, is it? Right, let's go through the most common approaches men try, starting with the least helpful and working our way up to the ones that actually have science behind them. Mistake number 1, and this is a big one, falling for scams and quick fixes. Everywhere you look online, there are adverts for miracle creams, pills, patches, and all manner of dubious injections. They promise dramatic gains in length or girth, often with before and after photos that have quite obviously been manipulated. But here's the truth, and I need you to really hear this. There is zero clinical evidence, none whatsoever, that pills or lotions can make your penis permanently larger. It's biologically impossible, and I'll explain why. A cream, no matter what exotic ingredients it claims to contain, cannot penetrate deeply enough into the tissue to alter the connective tissue structure or the smooth muscle that determines size. It's like expecting a moisturizer to make your arm longer. It simply doesn't work that way. The pills that are marketed for size usually contain herbs that might mildly increase blood flow. Ginkgo biloba, that sort of thing. At absolute best, they might give you a slightly firmer erection, which could create the illusion of being marginally larger. But they cannot and do not increase the actual size of the organ. It's physiologically impossible. And here's the emotional cost that people don't talk about. Falling for these scams sets you up for disappointment, time after time. You spend money, sometimes quite a lot of money, you get your hopes up, and then nothing happens. Or worse, you experience side effects because these products aren't properly regulated. I've had patients come to me with rashes, allergic reactions, and in one particularly unpleasant case, a chap who'd ordered something off the internet that turned out to contain undisclosed pharmaceutical ingredients that interacted badly with his heart medication. Please, please, don't put unregulated substances on or in your body. Mistake number 2, and this is something I feel quite strongly about, ignoring the psychological component. I want you to ask yourself a question, and be honest with yourself when you answer it. Are you chasing size, or are you actually chasing confidence? Because those are two very different things, and the solution to each is completely different. Studies have shown that when men with size anxiety receive psychological support, cognitive behavioral therapy, counseling, that sort of thing, without any physical treatment at all, the majority of them stop feeling the need for enlargement. They don't change physically. What changes is how they perceive themselves. That's remarkable when you think about it. Their bodies stayed exactly the same, but their distress disappeared because the problem was never really about centimeters. It was about self-perception. Now I know what some of you are thinking. That's all very well, Dr. Caldwell, But what about when you're trying to meet someone new? What about those early encounters before any emotional connection has developed? And you're absolutely right to raise that. The advice about partners being satisfied is genuinely true and genuinely helpful for men in established relationships, but it doesn't address the anxiety that single men feel when they're dating, when every new encounter feels like a test. Here's what I tell those patients, and I want you to really take this on board. Confidence, genuine confidence, is far more attractive and far more important to sexual satisfaction than size. I know that sounds like a platitude, but it's backed by research. Studies consistently show that women rate confidence, attentiveness, and emotional connection as more important factors in sexual satisfaction than physical dimensions. And here's the thing about confidence: you don't have to feel it initially to project it. You can, as they say, fake it till you make it. Behaviors of confidence, making eye contact, being present, being attentive to your partner, these are skills you can develop regardless of how you feel about your body. Let's move on to something with actual scientific backing. Option number 3, penile traction devices, also known as extenders. Now we're getting into territory where there's genuine clinical evidence. These are mechanical devices that apply steady, gentle traction over time. Think of it like orthodontics for tissue, similar principle to how braces gradually move teeth. In properly conducted clinical studies, men who used these devices for several hours daily over a period of months gained an average of about 2 centimeters in stretched flaccid length, which correlates quite closely with erect size. Some studies have shown gains of up to 37% in specific measurements, which is likely where that figure you might have seen comes from. But, and this is a significant but, there are important caveats. First, it requires genuine dedication. We're talking about wearing a device for 4 to 6 hours every day, for 4 to 6 months minimum. That's a serious commitment. Second, the devices need to be medical grade and used correctly. Too much tension and you risk injury. Too little and you won't see results. Third, individual results vary considerably. Some men see meaningful gains. Others see minimal change, despite following the protocol correctly. And fourth, the gains are modest in absolute terms. We're talking centimeters, not the dramatic transformations promised by dodgy adverts. If you're interested in trying traction therapy, here's my practical advice. Only purchase devices that have been used in clinical trials. There are several reputable brands. Start with lower tension and gradually increase. Be consistent because sporadic use won't produce results. Keep a log of your progress and be patient. This is a marathon, not a sprint. I had a patient last year, retired gentleman from Surrey, who used a traction device consistently for 8 months. He gained about 1.5 centimeters, which doesn't sound like much on paper, but for him, it made an enormous psychological difference. Not because of the physical change itself, but because he'd taken action. He'd been disciplined, and he'd achieved a result. Sometimes the process matters as much as the outcome. Option number 4, vacuum pumps. Let me be very clear about what these do and don't do. Vacuum erection devices create temporary engorgement by drawing blood into the penis. They can be useful, genuinely useful, for men with erectile dysfunction who struggle to achieve or maintain firmness for intimacy. But here's the crucial point. They do not increase length permanently. The effect lasts only as long as you maintain the vacuum or use a constriction ring. And even then we're talking about temporary tumescence, not permanent enlargement. If anyone tries to sell you a pump specifically for permanent enlargement, walk away. They're either misinformed or deliberately misleading you. That said, I've had patients tell me they've achieved permanent gains through pumping. I've read the forum posts, I've heard the anecdotal reports. And look, I'm a scientist. I have to go where the evidence leads. The formal studies we have show temporary effects only, but those studies may not have used the protocols that these men describe. The truth is, the research in this area is limited, and individual experiences vary. If you've had success with pumping, I'm not going to tell you you're imagining it. But I also can't recommend it as a proven enlargement method based on current evidence. Mistake number 5, and this is where we enter genuinely dangerous territory: unregulated injections and dodgy surgical procedures. This is the dark underbelly of the enlargement world, and I've seen the consequences in my clinic more times than I'd like to remember. Some clinics, often overseas, but sometimes right here in the UK, operating in regulatory grey areas, offer injections of silicone, various oils, hyaluronic acid fillers, and other substances directly into the penis. The risks are severe. We're talking about tissue scarring, chronic pain, infection, permanent erectile dysfunction, and disfigurement that can emerge years after the initial procedure. I've treated men who had injections done abroad in their 30s and came to me in their 50s with complications that required reconstructive surgery. As for surgical interventions, procedures like suspensory ligament release can make the penis appear longer when flaccid by allowing more of the internal portion to hang externally. But they do not increase functional erect length, and they can actually cause erectile instability because that ligament serves a purpose. Patient satisfaction rates for these procedures are generally poor, and complication rates are high. My strong advice is this: unless you have a diagnosed medical condition like true micropenis and you're being treated by a qualified surgeon in a properly regulated setting, ideally as part of a clinical trial, avoid surgical enlargement procedures. The risk-benefit ratio simply doesn't justify it for men with normal anatomy who are unhappy with their size. Now, one thing I want to address directly, because I've seen it come up repeatedly in patient conversations and in online discussions. Some of you are thinking about your partner's previous experiences. You know or suspect that a previous partner of hers was larger, and it's affecting your confidence. I understand this is painful, but I need to give you some perspective. First, size is only one factor among many that contribute to sexual satisfaction, and research consistently shows it's not the most important one. Technique, attentiveness, emotional connection, stamina, creativity, these all matter more to most women's satisfaction than dimensions. Second, what works for one person doesn't necessarily work for another. A previous partner's anatomy isn't some gold standard your partner is comparing you to. Every relationship is different. Third, if you're with someone who makes you feel inadequate about your body, that's a relationship problem, not a size problem. A caring partner doesn't weaponize physical comparisons. So what do I actually recommend to my patients who come to me concerned about this? Let me give you my standard protocol. First, get the facts. Measure properly, using the standardized technique from the base on top to the tip with an erection. Understand what's actually normal and recognize that you're very likely within that normal range. Remember the survey data. Your partner is probably far more satisfied than you think. Second, address anxiety first. Genuinely consider counseling or therapy, because if the root cause is psychological, no physical intervention will solve it. You'll achieve your goal and move the goalposts. I've seen men gain measurable size through traction and still feel inadequate because the problem was never really about centimeters. Third, if you still want a physical option after addressing the psychological component, traction therapy has the best evidence behind it. Just go in with realistic expectations. We're talking about modest gains over many months, not overnight transformation. Fourth, focus on what you can control right now. This is actually where you can make the biggest practical difference to your sexual function and confidence. Optimize blood flow through regular cardiovascular exercise. Walking, cycling, swimming, whatever you enjoy. Here in Britain, we're not exactly blessed with California weather, but even walking briskly in the rain counts. Eat a proper diet, more vegetables, less processed rubbish, moderate alcohol. Alcohol is a vasodilator initially, but becomes a vasoconstrictor, and chronic use significantly impairs erectile function. Consider natural nitric oxide support through diet. Beetroot juice is actually quite effective, as are dark leafy greens. Manage your hormones, and if you're over 50, it's worth having your testosterone checked because low T can affect both function and libido. Reduce stress because cortisol is the enemy of sexual function. Get enough sleep. Stop smoking if you smoke because it's absolutely devastating for vascular function, including erectile function. Fifth, and I cannot emphasize this enough, work on your overall sexual skills. Learn about female anatomy and pleasure. Understand that penetrative sex is only one component of intimacy. Become genuinely skilled at the full range of sexual activities, and size becomes far less relevant. The best lovers I've heard described by patients' partners, by female colleagues speaking frankly, are not the largest. They're the most attentive, the most creative, the most generous. I want to speak directly to those of you who are single and dating, because I know the advice about established relationships can feel irrelevant to your situation. You're worried about that first intimate encounter, before there's any emotional bond, when it feels like pure physical judgment. Here's my honest assessment. Yes, there are some people out there who prioritize size above all else. But they're a minority, and frankly, they're probably not people you'd want a relationship with anyway. Most people are far more interested in whether you're kind, whether you're attentive, whether you make them laugh, whether you make them feel desired and appreciated. These things matter enormously, and they're entirely within your control. The anxiety you feel, the fear of judgment, that's the real barrier, not your body. I've treated men across the entire size spectrum who have wonderful, satisfying, intimate lives, and I've treated men who are statistically above average, who are crippled by anxiety and can barely function. The correlation between actual size and sexual confidence or satisfaction is remarkably weak. The correlation between self-perception and satisfaction is very strong. I realize this isn't the magic solution some of you were hoping for. There's no pill that will add 3 inches overnight. There's no cream that will transform your body. But there are genuine options for modest physical improvement. There are effective treatments for the anxiety and confidence issues that are often the real problem. And there are absolutely ways to become a better, more confident, more satisfying lover, regardless of your physical dimensions. Listen, your worth as a man is not measured in inches or centimeters. Your partner doesn't see you the way you see yourself in the mirror. Science shows us repeatedly that men who focus on overall health, on confidence, on genuine connection, have far more fulfilling intimate lives than men who obsess about size. It's not even close. If you're worried about this, please don't carry that burden silently. Talk to your GP, talk to a urologist if you can get a referral. Consider speaking with a counselor who specializes in sexual health issues. And remember, there's nothing wrong with you. Your body isn't broken. The standards you're comparing yourself to are artificial, created by an industry that profits from your insecurity. At the end of the day, you don't need to chase risky procedures or empty promises. Small, smart, evidence-based steps like traction therapy. If you want a physical option, blood flow optimization through exercise and diet, and addressing the underlying anxiety can make a bigger difference than you might think. And the real key to satisfaction, both yours and your partner's, it isn't size. It's confidence, it's intimacy, it's skill, it's being fully present in the moment. Take care of yourself. Respect your body. Know that your best years of vitality and intimacy don't have to be behind you. I've seen men in their 60s and 70s with better sexual function and more satisfying relationships than they had in their 20s, because they finally addressed the things that actually mattered. If this video has been helpful, please hit that like button. It genuinely helps other men find this information, and there are a lot of blokes out there suffering in silence who could benefit from hearing the truth rather than the marketing nonsense. Leave a comment. I do read them, and I try to respond when I can. Subscribe to the channel because I put out new content every week covering all aspects of men's health, particularly for those of us with a bit of mileage on the clock. Until next time, I'm Dr. Sophie Caldwell, reminding you that your value as a person has absolutely nothing to do with numbers on a ruler. Take care of yourselves, gentlemen, because you're absolutely worth it.